Look at your nails right now, both hands. There are 7 specific signs on your nails that can reveal your heart has a problem. And here's the scariest part. These signs can appear months, sometimes years, before someone discovers a serious heart condition. But because nobody teaches us to look at our nails with that medical eye, the signal gets missed. The nail has a strange line. The person thinks they bumped it without noticing. The nail is whiter, they think it's just lack of polish. The fingertip is more rounded, they don't even notice, and the heart keeps getting sick in silence. Experienced cardiologists begin the physical exam by looking at the hands. They look at the nails, they look at the nail bed, they look at the fingertips, because the nail is a mirror of what's happening inside. Today I'm going to show you the 7 signs, each one with a real medical mechanism, a home test, and what to do. If you're past 60, this video can change your life. Subscribe to the channel, turn on the bell, and tell me in the comments where you're watching from. Before I show you the 7 signs, I need to give 2 extremely important warnings. First warning, this video does not replace medical consultation. The signs I'm going to show are alerts for you to seek cardiological and clinical evaluation, not for self-diagnosis or self-medication. Found a sign? Schedule a consultation. Have doubts? Schedule a consultation. Taking medication for the heart, blood pressure, cholesterol, diabetes. Never, ever stop on your own. These medications save lives, and stopping can cause heart attack, stroke, decompensated heart failure. Always talk to your cardiologist before any change. Second warning, even more urgent. If you're feeling right now strong chest pain, pain radiating to the left arm, jaw or back, sudden shortness of breath, cold sweat, nausea, intense pallor, or severe dizziness, this could be an ongoing heart attack. Don't wait it out. Don't take medicine. Don't drive yourself. Call 911 now or ask someone to call. Time of care in a heart attack is heart muscle saved. Don't lose a minute. Now let's go to the 7 signs on the nails. The first sign is digital clubbing, also called Hippocratic fingers or watch glass nails. It's a change in the shape of the nails and fingertips of the hands and feet. The nail becomes more curved, more rounded, like an inverted watch glass. The fingertip becomes wider, more bulbous, looking like a drumstick. The medical mechanism involves chronic hypoxia, that is, lack of adequate oxygenation in tissues for a long period. The body, sensing the lack of oxygen in the extremities, promotes proliferation of tissues under the nail as an attempt to compensate. Cardiac causes of clubbing include infective endocarditis, which is a serious infection of the heart valves, cyanotic congenital heart disease in adults, and some long-standing severe valve diseases. Pulmonary causes are even more common, such as pulmonary fibrosis, lung cancer, bronchiectasis, and advanced chronic lung diseases. Attention: clubbing develops over months or years. If you always had nails like that, it's probably not a change. If there was gradual change in recent months or years, it's an important sign. How to test at home. Shamroth test. Bring the nails of 2 opposing fingers together by the tips, with fingers extended and pointing up. Look from the side. In a person without clubbing, a small window or rhombus forms between the 2 nails. When there's clubbing, this window disappears and the nails stay glued. Simple, free test you can do now. What to do? Broad investigation with cardiologist, pulmonologist, and general practitioner. Tests like echocardiogram to rule out valve problems and endocarditis, chest tomography to evaluate the lung, and complete blood count. The second sign is splinter hemorrhages, also called subungual linear hemorrhages. They are small red, brown, or black lines, thin under the nail, that really look like splinters or shards stuck in the nail. The medical mechanism involves small clots that break capillaries under the nail bed. The most common cause is local trauma, like hitting the finger or using the nail as a tool. But here's the important part. When splinter hemorrhages appear on several nails at the same time, without identifiable trauma, this is a classic sign of infective endocarditis, a serious infection that affects the heart valves. Endocarditis is a medical emergency. Without treatment, it can lead to acute heart failure, stroke from septic embolism, and death. Other causes of multiple hemorrhages include vasculitis, systemic lupus erythematosus, and hematological diseases. How to test at home. Look at all your nails on the hands calmly, in natural light. Found a small red or brown line on one nail? Probably trauma. Found several, on several nails, without remembering hitting them? Attention. Especially if accompanied by prolonged, unexplained fever, weight loss, night sweats, or newly diagnosed heart murmur, seek emergency care immediately. What to do? Urgent investigation with blood cultures, transthoracic echocardiogram, and, if necessary, transesophageal complete inflammatory tests. The third sign is Terry's nails. It's a very specific pattern in which the nail bed becomes almost entirely whitish, opaque, with only a small pink or brown band of 1 to 2 millimeters at the free edge of the nail near the fingertip. The mechanism involves vascular alterations in the nail bed caused by systemic diseases. The most common causes are congestive heart failure, especially when associated with low albumin, liver cirrhosis, diabetes mellitus, advanced chronic kidney disease, and isolated aging in some cases. Terry's nails were first described in patients with cirrhosis, but in elderly people with cardiovascular problems, they are also frequent. How to test at home. Look at your nails in natural light, without polish. Compare with old photos. Are the nails much whiter than before, with that little pink band only at the tip? That can be Terry's nails. What to do? Evaluation with general practitioner, cardiologist, hepatologist. Basic tests: blood count, kidney function, liver function, albumin, echocardiogram, abdominal ultrasonography. Treating the underlying cause often improves the nails over time. The fourth sign is Bowes lines. They are deep transverse grooves that cross the nail from side to side, parallel to the lunula, that little white half moon at the base. The mechanism is a temporary interruption of the growth of the nail matrix during a severe systemic event. As the nail grows about 3 to 4 millimeters per month, the position of the line indicates approximately when the event occurred. If the line is in the middle of the nail, the event was about 3 months ago. If it's near the cuticle, it's more recent. Causes include acute myocardial infarction, sepsis, severe pneumonia, severe COVID, chemotherapy, severe malnutrition, and some medications. Finding Bowes lines in someone who had strange symptoms months ago and was never evaluated is a strong reason to investigate the heart and general health. How to test at home. Run your finger over the nail. Do you feel a horizontal groove, like a ditch? Look in lateral light. The lines stand out. Found them on several nails at the same time. It's a sign of a systemic event, not local trauma. What to do? Medical consultation with cardiovascular investigation if there was a history of chest pain or unexplained tiredness, and laboratory tests as evaluated. The fifth sign is koilonychia, popularly known as spoon nails. It's when the nail, instead of being flat or slightly convex, becomes concave, like the bottom of a spoon. It's so pronounced that if you placed a drop of water on the nail, the drop would stay accumulated there instead of running off. The mechanism is related to severe and chronic systemic deficiencies. The most common cause worldwide is severe long-standing iron deficiency anemia. Attention! Severe chronic anemia forces the heart to work much harder to compensate for the low oxygen carrying capacity, and that, over years, can lead to high-output heart failure, hypertrophy, and dilation of the heart. Other causes include hypothyroidism, hemochromatosis, coronary heart disease in some populations, lupus, and Raynaud's phenomenon. How to test at home. Drop a little drop of water on the nail. If the water runs off, the nail is normal or convex. If the water accumulates on the nail, it's a strong indication of koilonychia. What to do? Complete blood count, ferritin dosing, serum iron binding capacity, thyroid function, and cardiovascular evaluation. Treating anemia corrects the nail over time and protects the heart. The sixth sign is nail bed cyanosis, that is blue or purple coloration of the nail bed. The mechanism is hypoxia, an inadequate oxygenation of the blood reaching the extremities. Cardiac causes include advanced heart failure, uncorrected cyanotic congenital heart disease in adults, chronic severe valve diseases, and right-to-left shunts. Pulmonary causes are equally important: severe COPD, pulmonary fibrosis, pulmonary embolism, and restrictive lung diseases. Important attention: people with darker skin naturally have a slightly darker nail bed, and that is not cyanosis. True nail bed cyanosis is a blue-purple that persists even in a warm environment, compared to the expected pink color. How to test at home? Look at the nails in a well-lit environment, in natural light. Compare the color of the nail bed with the color of the lower lip. If the bed is more purple than the lip, it's an alert sign. Another test: does the nail bed remain purple even after warming the hands with warm water or rubbing them together? Attention! What to do? Pulse oximetry, arterial blood gas, echocardiogram, chest X-ray or tomography, electrocardiogram, and complete clinical evaluation. The seventh sign is nail bed pallor accompanied by slow capillary refill time. The healthy nail bed is pink, reflecting oxygenated blood in the capillaries. When the nail bed becomes pale, whitish, but not as white as in Terry's nails, this can indicate anemia or systemic poor perfusion. Anemia, especially chronic and severe, overloads the heart, possibly leading to high-output heart failure. Poor perfusion can indicate heart failure, chronic hypertension, or circulatory shock in the most severe forms. The capillary refill test is simple, and cardiologists love to do it. Press firmly on the nail for 3 seconds, then release and count how many seconds the pink color takes to return. In a healthy person, it takes less than 2 seconds. More than 2 seconds is prolonged time, a sign of poor perfusion. Repeat the test on several nails. How to test at home? Sit in a place with good lighting. Compare the color of your nail beds with old photos or with the skin of the wrist. Is it much paler? Attention! Do the capillary refill test. What to do? Blood count with hematocrit and hemoglobin, dosing of iron and ferritin, vitamin B12, folic acid, kidney function, and complete cardiological evaluation. If you found any of these 7 signs at home, I ask you one thing: take a deep breath. Don't panic. Finding a sign doesn't mean you're having a heart attack now. It means it's worth scheduling a consultation. And that consultation can be literally what changes your story. God bless you and give you much health. Until next time. Share this video with someone you love, especially if that person has already passed 60, is hypertensive, diabetic, a smoker, or has a family history of heart attack. The right information to the right person saves lives. And tell me in the comments, did you find any of these signs when looking at your nails now? Which one was it? Now let me talk about the risk factors that increase the chance of having these signs and developing heart problems. There are 8 main ones: arterial hypertension, poorly controlled diabetes, high cholesterol, especially elevated LDL, active or recent smoking, abdominal obesity, sedentary lifestyle, family history of early heart attack in parents or siblings, and untreated chronic stress. The more factors you have, the greater the risk. The good news is that 7 of those 8 factors are modifiable. You just don't change family history. Everything else responds to treatment and habit change. And that change, when done seriously and with medical follow-up, drastically reduces the risk of serious cardiovascular events. Frequently asked questions. How long does one of these signs appear before a serious heart problem? There's no fixed rule. Clubbing can appear over years. Bowes lines appear after an acute event, weeks to months. Multiple splinter hemorrhages indicate something happening now. I always wear polish. Can I see these signs? No. Remove the polish at least once a month, leave the nails free for 1 or 2 days, and observe. I'm diabetic. What's my situation? Diabetics have higher cardiovascular risk and higher probability of nail changes. Inspecting hands and feet daily is already a basic recommendation for diabetes care. I do chemotherapy. My nails are strange. Chemotherapy can cause Bowes lines, darkened nails, fragility. Talk to your oncologist. I had a heart attack a year ago. Should I worry about the nails? It can be useful to observe. Bowes lines can appear months after a heart attack. Practical action plan in 7 steps. First step, tonight, examine all your nails on the hands and feet calmly, in natural light, without polish. Observe coloration of the nail bed, shape of the nails, presence of lines, streaks, grooves, concavity or convexity, capillary refill time. Write down what you saw. Second step, if you found any alteration, or if you've already passed 60 without a recent cardiological consultation, schedule a consultation with a general practitioner or cardiologist this week. Third step, go to the consultation with a list of medications, previous tests, and family health history. If possible, bring photos of your nails. Fourth step, do the basic tests the doctor requests: blood count, blood glucose, glycated hemoglobin, total cholesterol and fractions, triglycerides, kidney function, liver function, albumin, electrocardiogram. As needed, echocardiogram, blood culture, chest tomography. Fifth step, if you smoke, start the process of quitting now. Seek help. Medicare covers smoking cessation counseling. Sixth step, start walking daily, at least 30 minutes. Walking is the most studied exercise for cardiovascular health. Seventh step, adjust nutrition. Reduce ultra-processed foods, sodas, processed meats, fried foods. Increase vegetables, fruits, fish, legumes, olive oil. The Mediterranean diet is the most studied for the heart. Let's debunk important myths. Myth 1. Every white spot on the nail is a sign of a problem. False. Small, isolated white spots, called leukonychia, are usually caused by trauma to the nail matrix and are benign. Larger patterns like Terry's nails or half and half are the ones that deserve investigation. Myth 2. Taking gelatin strengthens nails and cures everything. False. Gelatin has no solid evidence of improving fragile nails. Balanced nutrition and treating the underlying cause is the way. Myth 3. Cutting the cuticle is necessary for healthy nails. False. The cuticle protects the nail matrix against infections. Myth 4. Home teas correct cardiac alterations seen in nails. False. No tea or home remedy replaces medical investigation and treatment. Myth 5. If blood pressure is controlled, I can't have these signs. False. Controlled pressure reduces risk, doesn't eliminate it. An important reflection: the body is intelligent, it always warns beforehand. The problem is that we learn to ignore the small warnings, thinking they will pass. The nail is a business card of what is happening inside the body. Looking at your nails carefully at least once a month is a simple, free, and potentially life-saving habit. Let's talk a little about the heart of women after 60. After menopause, female cardiovascular risk increases a lot because estrogen, which has a protective effect on the arteries, drops. Many women think a heart attack is a man's thing. Not anymore, and the heart attack in women tends to have more atypical symptoms, like extreme tiredness, shortness of breath without clear reason, pain between the shoulder blades, nausea. Talking now about men's hearts. The typical male heart attack tends to have more classic symptoms, but can also be silent, especially in diabetics. Another important point for men: erectile dysfunction can be an early sign of cardiovascular disease. The penile artery is thinner than the heart artery, so it suffers first with atherosclerosis. About nutrition for the heart and nails, in summary: increase green leafy vegetables, fruits, fatty fish like sardines and salmon, extra virgin olive oil, legumes, nuts, seeds, eggs, and lean proteins. Reduce ultra-processed foods, sodas, processed meats, fried foods, added sugar in excess, salt in excess. About exercise, in summary: walk at least 150 minutes per week. Include 2 to 3 days a week of light strength exercise with weights, bands, or body weight. And take care of balance with Tai Chi, adapted yoga, or specific exercises. About sleep, in summary: sleeping poorly, sleeping little, or having untreated sleep apnea are real cardiovascular risk factors. Polysomnography can detect apnea and CPAP treatment significantly reduces cardiovascular risk. About stress and mental health. In summary, untreated chronic stress, anxiety, depression are cardiovascular risk factors often forgotten. Taking care of mental health is part of taking care of the heart. An honest, practical summary. 7 signs on the nails can indicate important cardiovascular or systemic problems. Digital clubbing, splinter hemorrhages, Terry's nails, Bowes lines, koilonychia, nail bed cyanosis, and pallor with slow capillary refill. Each has a real medical mechanism and a simple test at home. Finding a sign is not a diagnosis, it's an alert to seek medical evaluation. Cardiologist and general practitioner are the indicated professionals. Basic tests: blood count, iron, electrocardiogram, echocardiogram, kidney function, liver function, and complete cardiovascular evaluation. Treatment involves rigorous control of pressure, cholesterol, diabetes, quitting smoking, regular exercise, healthy nutrition, and medications as indicated. Never stop cardiac medication on your own, and on suspicion of acute heart attack, call 911 immediately. God bless you and give you much health. Until next time. If this video helped you, share it with someone you love. It can be the information that changes the life of a dear person. Take care of yourself with wisdom, with attention to the body, with true information, and with much self-love. You deserve a strong heart, days with energy, and a long life. God bless you. Until next time. Amen. Share with those you love, especially with people who have also passed 60. God bless you. Until next time. Amen. Health and blessings. Take care always. Keep faith and daily care. God bless you. Until next time. Amen. Health, peace, and faith. Amen. Take care with love. Your life matters. Your heart matters. Your family matters. God bless you. Until next time. Amen. Blessings to your family. Amen. Good night. Take care. Amen. Peace and blessings. Amen. Health, peace, faith, and love. Amen. A final reflection on heart care and the journey of aging. The heart beats over 100,000 times a day, every day, without rest, your entire life. It deserves your attention, your care, your investment. Every healthy choice protects it. Every walk, every consultation, every medication taken correctly, every food choice. You are not a passenger in your heart's health. You are the pilot. Drive with care. A practical reminder. Cardiological consultation is recommended at least once a year for everyone over 60. The consultation is quick, the basic tests are simple, and the result can be priceless. Don't postpone it. Schedule this week if you haven't done it yet. Your future self will thank you. Final word about community. We don't take care of our health alone. We take care with family, with friends, with our medical team, with our community. Talk about heart health with people you love. Encourage that friend to do the checkup. Walk together, share healthy recipes, reduce processed foods together. Health is built in community, and aging well is a collective achievement. God bless you. Until next time. Amen. Walk in peace. Eat with gratitude. Sleep well. Talk to your doctor. Laugh with loved ones. A good life is built this way. Peace and blessings. Amen.